A very good morning and welcome to the session on the very important topic that is fibroid uterus and management. We are glad to have Dr. Seema Sharma among us today to help us understand the topic. The doctor will take us through that more in the session today. So stay tuned till the end. The doctors will take up all your questions and queries at the last of the session. Just post that on the comment section and stay there for the while. The doctor will answer all your questions. Now, doctor, you have the stage now.
Good morning, viewers. I'm Dr. Seema Sharma. I'm a senior consultant OB-GYN in Apollo Hospital, Amritsar. Today, I'm going to talk on fibroid uterus and how to deal with the fibroids in the uterus. That is how to manage them. This is first of all, we must know what are the fibroids in the uterus. These are the most common benign tumor of the uterus. Benign meaning they are not cancerous tumors, they are benign ones. So these are the most common tumor in the childbearing age of women, and their incidence is almost 30 to 40% in OB-GYN OPD, and uh, they can be very small fibroids in the uterus. They are as small as peanut size, or they can be very big fibroids. They can be as big as volleyball or football size fibroids, and they can expand the uterus and they can distort the cavity also. They can be single fibroids or they can be multiple fibroids in the uterus. And now coming to why the fibroids develop in a female, what are the causes? Mostly the causes are genetic, sometimes genetic changes in the genes of the smooth muscle fibers of the uterus are there, which lead to the development of fibroids. They can be hereditary. Hereditary meaning if a mother or sister in the family have fibroids, then there is likelihood of having fibroids in that female increases. There can be hormonal factors like mostly females have estrogens and progesterones, and whenever the level of estrogen progesterone increases, we have seen the growth of fibroid increases. So especially जैसे कि देखा जाता है प्रेगनेंसी में नॉर्मली फाइब्रॉइड्स जो हैं उनके ग्रोथ इंक्रीज हो जाती है. So so this proves that there is a hormonal basis of these fibroids, and there are few high risk factors also which lead to the growth of these fibroids, like if the patient is obese, there is more likelihood of having fibroids. If the childbearing age is late, we have seen that they have more chances of having fibroids. Similarly, if patient is smoking, if the diet is mainly based on the red meat and all, in those cases fibroids are more. And in certain races, especially blacks, have more fibroids as compared to the whites, and even Asians have more fibroids as compared to the white race. So these are some of the risk factors and causes. And then coming to the symptoms of fibroids. What are the symptoms of fibroid? Mostly the fibroids are asymptomatic. They don't produce any symptoms in most of the cases. That is why they are not diagnosed early. Whenever patient gets examination done for some other problem, gynecological problem, or goes for ultrasound for some other reason, they are incidental finding on ultrasonography or on examination. So most of the fibroids they don't produce any symptom, but some of the fibroids have symptoms also, like heavy bleeding during the periods, flow is very heavy and they pass clots. Some of the patients have constant pain in the pelvic region, pelvic pressure. They have urinary problems like frequent urination, or they have difficulty in passing urine. And some of the large fibroids, they cause most of the pelvic pressure symptoms, difficulty in urination, constipation, backache. And in reproductive age group, some of the patients have difficulty in conceiving also, so they have fertility issue. They cause problems in fertility also. So these are some of the symptoms of the fibroids. And symptoms sometimes these fibroids, rarely they can cause acute pain also. These pain is when the size of the fibroid increases too much, and blood supply to the fibroid is that is not sufficient to maintain that fibroid, and fibroid then undergoes degeneration. ये degenerate होने लग जाता है, and then it begins to die, and that causes pain. समटाइम्स फाइब्रॉइड्स जो है वो काफ़ी यूटस के साथ लगे हुए पेडंकुलेटेड टाइप होते हैं, स्टॉक विद लॉन्ग स्टॉक्स, दे गेट टॉर्शन एंड देन ऑल्सो देयर कैन बी पेन. So mostly the symptoms जो होते हैं fibroids के, they depend upon the location of fibroids. So it is very important to understand the types of fibroids depending upon the location. Symptoms are based on location, size, and whether they are single or multiple. So to understand fibroid, we must know the classification of fibroids. Classification depends upon the location. सो लोकेशन अंडरस्टैंड करने के लिए हमें यूट्रस के बारे में थोड़ा सा पता रहना चाहिए कि यूट्रस कैसे रहता है. सो दिस इज द यूट्रस, नॉर्मली इट्स अ चाइल्ड बेयरिंग ऑर्गन. सो यूट्रस के एक आउटर सरफेस रहता है, दिस इज द आउटर सरफेस ऑफ द यूट्रस. दिस होल इज द आउटर सरफेस ऑफ द यूट्रस, एंड in between the uterus there is lining of the uterus, and it is called cavity of the uterus, which holds the baby inside. So this cavity, in between the cavity and outer surface, is the muscle layer. Muscle layer, this is the whole is the muscle layer of the uterus. So uterus has outer surface, muscle layer, and inner lining. So fibroids का location जो है, depending upon if the fibroids are located on the completely on the outer surface, इनको हम बोलते हैं subserosal fibroids, and mostly subserosal fibroids, they are asymptomatic. They produce symptom if they are very large fibroids. So second comes the, if the fibroids are located in the muscle layer of the uterus, they are intramural. Intramural are also like they produce less symptom as compared to the fibroids which are located inside the lining. If they are hanging in the cavity, or they are just adjacent to the inner lining of the uterus, these are submucosal fibroids. And mostly जो fibroids symptomatic होते हैं, these are the submucosal fibroids, because ये जब menstrual cycle आता है, so they bleed heavily and they cause severe dysmenorrhea, spasmodic dysmenorrhea also if they are in the cavity. So इनका diagnosis and further management is also depends upon the location and number of the fibroids and size of the fibroids. So this is about simple things about the fibroids, and then very important thing, when to see the doctor if you have fibroids. If somebody has fibroid and they get panicked if the ultrasound shows small fibroids, there's no need to panic if the ultrasounds have small fibroids in the uterus. You can just contact the gynecologist and take her advice. But if fibroid has, if the patient having fibroid has persistent pain, heavy bleeding, and there is bleeding in between the period, or some urinary or bowel problems are there, or patient is wants to conceive and is there's inability to conceive, in all those cases patient is uh, has to see the doctor to solve the problem. So these are some of the situations where the patient must contact the doctor. So coming to fibroids, how they are diagnosed. Fibroids are benign. Those I already told, they are diagnosed sometimes on ultrasonography. But in case you have there are symptoms, then best modality is ultrasonography, and they can be transabdominal ultrasound or transvaginal 3D ultrasounds are done. In the transabdominal ultrasounds, ultrasonography is done from the abdomen, and pelvic region is seen, and we see the we focus on the uterine side with bladder full, and fibroids are seen easily. In the transvaginal, inner side of the uterus is more seen, uh, inner lining is seen more accurately, and fibroids which are submucosal, they can be seen easily. So these are the first line ultrasonography is the first line investigation which is done for fibroids. Then comes the MRI. MRI is done in cases of if patient has multiple fibroids or big fibroids. It is usually done to see the location and to do the mapping of the fibroids. Mapping means where the fibroids are located and what is the distance from the inner lining is there, and it is mainly done before surgery if patient has multiple fibroid to map the fibroids, and it helps in removal of fibroids easily. So then other general tests are also done in cases where a patient bleed a lot. Routine investigation lab test, CBC done, hemoglobin level is seen, and to see that the patient is bleeding and it affects the hemoglobin also. And some of the investigations are done where the patient is not conceiving, and to see the inner lining or the of the uterus. These can be sonosalpingography to see the submucosal fibroid or whether the fibroid is blocking the tubes or not. So sonosalpingography is done with the infusion of saline into the uterine cavity, and the fibroids are then easily seen and they can be picked up on ultrasonography. And then is an invasive procedure to see to see the fibroids, which is called histoscopy. Histoscopy में क्या करते हैं कि through vagina, it can be office histoscopy where there is no anesthesia is given, or it can be routine histoscopy where general anesthesia is given, and उसमें हम एक telescope है introduce करते हैं through vagina into the cavity of the uterus, and fibroid uterine cavity is seen, and we can easily visualize the submucosal or intracavitary fibroid if they are causing lot of symptoms, and it is actually the best modality, but it's an invasive one. So these are some of the investigations which are to be done for the diagnosis. Then coming to the management part. Management means if the patient is asymptomatic, so and patient has fibroids which are small in size, and whether they are single or whether they are multiple, if they are not troubling the patient and the size is small, then these patients need wait and watch policy, because if the patient is in later age of more than 40 or nearing menopause, then after menopause these fibroids they shrink on their own, and fibroids are one tumor which have very less chances of getting converted into cancer. So wait and watch policy is the best for asymptomatic fibroids. But in case fibroids is not causing symptom but they are of very big size, then depending upon whether the patient is young or patient is nearing 50 or just nearing the menopause, then proper appropriate treatment can be given to the patient depending upon the size of the uterus. Then in patients where the patients are bleeding and they have lot of heavy menstrual bleeding, first is to control the bleeding. So in these patients, first hemostatic agents means medicines which control the bleeding. So these medicines are used. These are simple medicines which can be given for 3 to 4 days during the cycle to control the heavy flow, and thereby hemoglobin is maintained. So other agents which can be used to give a symptomatic relief to the patient, they can be GnRH and agonist. These are the medication which are hormone based. So when these injections are given, they reduce the level of estrogen, progesterone, and thereby uh, blocking the growth of fibroids. फाइब्रॉइड्स these agents जो होते हैं, ये जो medicines हैं, ये एक menopause like पिक्चर बना देती हैं पेशेंट का, एमिनोरिया क्रिएट कर देती हैं, पीरियड्स पेशेंट को पीरियड्स आने टेम्परेरली बंद कर देती हैं, जिससे फाइब्रॉइड्स दे स्टार्ट श्रिंकिंग इन साइज क्योंकि उनका ब्लड सप्लाई कम हो जाता है, उनको हार्मोन्स कम हो जाते हैं, सो दे श्रिंक इन साइज टेम्पररली टिल द टाइम वी आर यूजिंग दीज मेडिसिन। और ये मेडिसिन हम उन पेशेंट्स में यूज़ करते हैं जो जहाँ पे सिम्टम्स बहुत हैं, एंड पेशेंट समटाइम्स दे आर वेरी यंग पेशेंट एंड समटाइम पेशेंट्स आर नॉट मेडिकली फिट। उन पेशेंट्स में टेम्पररली एक सिचुएशन, मेनोपॉज लाइक सिचुएशन क्रिएट करके उनकी ब्लीडिंग को कंट्रोल किया जाता है, एंड टेम्पररली फाइब्रॉइड्स भी श्रिंक कर जाते हैं। लेटर ऑन व्हेन द पेशेंट इज फिट फॉर surgery or some procedure, then they can be taken for that procedure. So other agents जो bleeding control करते हैं but they don't shrink the fibroids, they can be हमारे आजकल इंट्रा यूट्राइन डिवाइसेस होते हैं जिसमें प्रोजेस्ट्रॉन रिलीजिंग IUCD बोलते हैं हम, इंट्रा यूट्राइन contraceptive devices हैं which release progesterone also. Marina is one of the that types. इसको इंसर्ट कर देते हैं, जैसे कि कॉपर टी को इंसर्ट किया जाता है इन यूट्रस, और ग्रेजुअली दे रिलीज द प्रोजेस्टेरोन विच हेल्प्स इन कंट्रोलिंग द ब्लीडिंग। बट ये फाइब्रॉइड्स को श्रिंक नहीं करेगी, बट ब्लीडिंग कंट्रोल हो जाएगी। सिमिलरली there are certain other drugs which control the bleeding, but they don't help in reducing the size of fibroids. So other NSAIDs like drugs which are painkillers, they can be used for symptomatic relief of pain and bleeding, but they are not the permanent solution. So nowadays, beside surgical, there are certain non-invasive procedure which help in reducing the size of fibroids. One of them is MRI guided focus ultrasound, sound waves which are used to shrink the size of the fibroid. In this, इसमें हम क्या करते हैं कि एक this is a kind of machine, MRI machine, where the patient is lies in the MRI machine, and then MRI is focused on the uterus, and fibroids are targeted, and then targeted beam of ultrasound sound waves are given to the fibroids, which shrink the fibroid. They completely destroy the fibroids and thereby treating the fibroid. बट कोई भी थेरेपी ऐसी नहीं फुल्ली फाइब्रॉइड्स को क्योर कर दे। दे रिड्यूस द वॉल्यूम ऑफ फाइब्रॉइड्स बाय 50 to 60%, thereby giving the relief to the patient from heavy bleeding and pain. Similarly, एक procedure रहता है which is semi invasive kind, which is called uterine artery embolization. यूट्राइन आर्टरी एम्बोलाइजेशन में जो एक जेल लाइक पार्टिकल्स हैं वो यूट्राइन आर्टरी विच इज अ ब्लड वेसल विच सप्लाइज द यूट्रस एंड फाइब्रॉइड। इसके अंदर ये जेल पार्टिकल्स को इंस्टिल कर दिया जाता है इस आर्टरी के अंदर, और इस आर्टरी को ब्लॉक कर दिया जाता है ताकि ब्लड सप्लाई जो फाइब्रॉइड्स को सप्लाई कर रही है वो ब्लॉक होने से फाइब्रॉइड जो है श्रिंक होना शुरू हो जाते हैं, and they are like patients are then gradually relieved from the heavy blood flow. और इस प्रोसीजर को हम कुछ infertile patient में भी use कर सकते हैं who have fibroids and they don't want to get the surgery done, and they have sometimes multiple fibroids. So इसकी uterine artery embolization से fibroids को shrink करके and then patient can go ahead with the air fertility treatment. So then after the medical treatment comes the surgical surgical methods which are used for fibroids. So ये सर्जिकल मैथड्स, फर्स्ट तो ये सर्जिकल मैथड्स कहाँ यूज़ होने, कौन से पेशेंट्स पे यूज़ होने हैं? पेशेंट्स हु हैव बिग फाइब्रॉइड्स, पेशेंट हु हैव वेरी सिम्टोमेटिक फाइब्रॉइड्स जो बहुत ब्लीड कर रही हैं, स्पेशली द सबम्यूकोसल वंस, or large intramural or multiple fibroids which distort the which expand the uterus and distort the inner cavity. ये सब फाइब्रॉइड्स जो हैं इनमें हम सर्जिकल मेथड यूज़ करते हैं, और आज के दिन में लैप्रोस्कोपिक सर्जरी होती है, और जो फाइब्रॉइड रिमूवल की सर्जरी उसको मायोमेक्टमी बोला जाता है। तो मायोमेक्टमी इट कैन बी लैप्रोस्कोपिक मायोमेक्टमी, इट कैन बी रोबोटिक मायोमेक्टमी। अगर ये मायोमेक्टमी हम एब्डोमेन के थ्रू करते हैं, टेलीस्कोप एब्डोमेन के थ्रू डाल के हम फाइब्रॉइड्स को रिमूव करते हैं, तो इसको लैप्रोस्कोपिक मायोमेक्टमी बोला जाता है। और इसमें सिमिलरली यूट्रस के अंदर कट देके एंड फाइब्रॉइड्स आर टेकन आउट। सो these fibroids once they are taken out, फिर इनको मॉर्सिलेट किया जाता है. मॉर्सिलेटर्स रहते हैं. मॉर्सिलेटर्स आर लाइक दे कैन यू कैन से कि इट्स अ ड्रिल मशीन, जिससे फाइब्रॉइड्स को स्मॉल स्मॉल पीसेस में चिप्स की तरह निकाला जाता है, एंड दे आर टेकन आउट फ्रॉम द एब्डोमिनल स्मॉल एब्डोमिनल इंसिजन्स ओनली. एंड द मॉर्सिलेशन जो है आजकल एक हम पहले बैग इंट्रोड्यूस करते हैं, उसमें फाइब्रॉइड रखते हैं और मॉर्सिलेशन उसके बैग के अंदर करी जाती है. सो दिस इज ऑल अबाउट लैप्रोस्कोपिक मायोमेक्टमी. और अगर फाइब्रॉइड्स जो हैं वो इनर लाइनिंग के पास हैं और यूट्राइन कैविटी में हैंग कर रहे हैं, तब लैप्रोस्कोप जो है इस एंडोस्कोप एंड विच इज इंट्रोड्यूस थ्रू हिस्टोस्कोप इज इंट्रोड्यूस थ्रू विजाना इनटू द यूट्रस. तो उसको हम हिस्टोस्कोपिक मायोमेक्टमी करते हैं. उसमें हम रिसेक्टोस्कोप का यूज करते हैं. इट्स अ काइंड ऑफ डिफरेंट इंस्ट्रूमेंट जिससे स्मॉल स्मॉल पीसेस में रिसेक्ट करके फाइब्रॉइड्स को निकाला जाता है. So these are two types of myomectomies which are done, and then comes the usual methods जो कि open methods रहते हैं. abdominal myomectomy in case बहुत बड़ा fibroids है, and it depends कि surgeon कौन सा option लेना चाहता है and patient कौन सा option में comfortable है. depending upon abdominal myomectomy भी करी जा सकती है. And patients who are nearing almost near menopause and they have multiple fibroids, big fibroids, उन patients के अंदर hysterectomy is the definitive solution, because hysterectomy के बाद दोबारा fibroids होने का chances नहीं रहते, and in these patients hysterectomy can be one option. Hysterectomy similarly can be laparoscopic hysterectomy or open hysterectomy depending upon the patient's condition and surgeon and patient's will. So these are all about fibroids. और एक बहुत क्वेरी रहता है कि जब भी पेशेंट्स हमारे पास आते हैं कि अभी फाइब्रॉइड रिमूव करा है तो ये दोबारा तो नहीं इसका रिकरेंस हो जाएगा. सो नॉर्मली जो हमने देखा कि अगर फाइब्रॉइड सिंगल है एंड व्हेन वी रिमूव द सिंगल फाइब्रॉइड देयर इज लेस चांसेस ऑफ रिकरेंस. बट इफ पेशेंट हैव मल्टीपल फाइब्रॉइड्स में हम कई बार इतने इतने फाइब्रॉइड्स रहते हैं कि सम ऑफ द फाइब्रॉइड्स जो कि सीडलिंग फाइब्रॉइड होते हैं, स्मॉल बहुत स्मॉल फाइब्रॉइड हैं विच आर नॉट विजिबल विद द नेकेड आई, these are left behind in the uterus. And moreover हम यूट्रस को बहुत ज़्यादा चीर फाड़ ज़्यादा करके उसको डिस्ट्रॉय भी करना नहीं चाहते, तो ऐसे में स्मॉल सीडलिंग फाइब्रॉइड्स कैन बी लेफ्ट बिहाइंड एंड these fibroids gradually grow over the period of time and they can recur. So there is a possibility then once fibroids they can recur later on also. So अब आता है कि फाइब्रॉइड्स का फर्टिलिटी के साथ क्या इशू रहता है. क्या बहुत सारे पेशेंट आते हैं, यंग पेशेंट्स हैं, उनके फाइब्रॉइड्स रहते हैं एंड दे आर इन दिस थिंग कि फाइब्रॉइड्स रिमूव कराएं, प्रेगनेंसी पहले करें कि फाइब्रॉइड्स रिमूव कराएं. तो इसका सिंपल एक फंडा रहता है कि एक तो जो भी है यू शुड टेक द एडवाइस ऑफ एक्सपर्ट. अगर फाइब्रॉइड्स मल्टीपल हैं or if they are near the lining of the uterus and they are distorting the cavity and they are blocking the tubes, in those cases fibroids need removal. And sometimes fibroids are very big fibroids, they are intramural fibroids, and they are partially distorting the cavity also. Patient has heavy bleeding also. In those cases also, in big fibroids also need surgery before conceiving. But the normal size fibroids, if they are there and they are not interfering with the cavity, then they don't need any surgical removal before conceiving. सो फाइब्रॉइड्स अगर एज सच पड़े रहें तो ये कभी तंग नहीं करते. दीज आर वेरी बिनाइन काइंड ऑफ ट्यूमर्स. एंड अनदर थिंग इज कि अगर ये प्रेगनेंसी में ऑलरेडी पेशेंट इज प्रेग्नेंट एंड डायग्नोज विद फाइब्रॉइड, तब भी पेशेंट काफ़ी स्केयर हो जाते हैं कि हमारे फाइब्रॉइड है. So there's nothing to be scared about with the fibroids. अगर fibroids outer surface में हैं and they are not very big, even big fibroids के साथ भी pregnancy continue अच्छे से चल जाती है if they are on the outer surface. If the fibroids they are partially displacing the uterine cavity in inner lining के साथ interfere कर रहे हैं, then there are chances कि कभी कभी miscarriages के chances हो जाते हैं, preterm deliveries हो जाती हैं, और बेबी की कभी कभी ये प्लेसेंटा को के रास्ते में आ जाते हैं, प्लेसेंटा इनके ऊपर इम्प्लांट हुए होते हैं एंड प्लेसेंटा प्रीमेच्योर लेबर के साथ साथ अब्रप्शन हो जाता है, मतलब ब्लीडिंग स्टार्ट हो जाती है प्लेसेंटा से, सम इन वेरी फ्यू केसेस, एंड समटाइम ये इतने बड़े होते हैं एंड दे आर डिस्टॉर्टिंग द कैविटी, तो बच्चे की ग्रोथ पे समटाइम्स ग्रोथ रिस्ट्रिक्शन हो जाती है, ग्रोथ पे इफेक्ट कर सकते हैं. सो डिपेंड्स कहाँ पे इनका लोकेशन है, साइज क्या है, एंड दे कैन कॉज सम डिफिकल्टीज इन प्रेगनेंसी, एंड ये सब कॉम्प्लिकेशंस प्रेगनेंसी में एक्सपेक्टेड है विद फाइब्रॉइड्स. So this was all about fibroids in simple, small simple things about fibroid. Anybody if you want to ask something is welcome. So I feel there are no questions. So I thank you for the patient listening. I end my session here. Thank you very much.